Cognitive Behavioural Therapy, or CBT, is a short-term goal-oriented psychotherapy treatment focused on solving current problems and changing unhelpful thinking and behaviour patterns. It is one of the most researched and empirically supported treatments for many mental health issues, and has been found effective for treating depression, anxiety, obsessive-compulsive disorder, and many stress-related issues. In this video, we will provide an overview of CBT, including its history, main principles, the process and techniques commonly used. CBT was developed in the 1960s by psychiatrist Aaron Beck, originally to treat depression. He found cognitive therapy more effective than psychoanalysis for most of his patients. Around the same time, psychologist Albert Ellis was developing rational emotive behavior therapy, now called rational emotive therapy, which had similar principles. The integration of the cognitive and behavioral techniques became what we now know as CBT. What is the core idea of CBT? CBT is based on the cognitive model, which states that thoughts, feelings, and behaviors are interconnected. Our thoughts and beliefs about a situation influence our feelings and behaviors, which in turn reinforce those initial thoughts and beliefs in a repeating cycle. If we have unhelpful thoughts and feelings, this can lead to unhelpful behavior, which can turn into a vicious cycle of further negative thoughts and so on. CBT aims to help us learn to recognize these unhelpful patterns, to deal with overwhelming problems in a more positive way by breaking them down into smaller parts. By changing these negative patterns, we can improve the way we feel. From then, you develop new approaches to change unhelpful thoughts and behaviors. There are several key principles of CBT. First, our thoughts, not external events, determine how we feel and act. It's not the situation itself that determines our response, but how we interpret that situation. Second, many of our long-held beliefs and habitual reactions are irrational or inaccurate. In CBT, the process is to help identify these types of problematic thought patterns such as all or nothing thinking, jumping to conclusions, catastrophizing and overgeneralizing, etc. Third, we can learn to identify and correct these unhelpful cognitions and reactions. By changing our thoughts and beliefs through active homeworks type exercises, we can change our feelings and behaviors. Here are some of the techniques used. Cognitive restructuring. This is the process of challenging negative thoughts and beliefs and developing more helpful and realistic ways of thinking. Journaling. Tracking and writing down thoughts, feelings, and behaviors to recognize patterns. Behavioral experiments. Testing the accuracy of thoughts through experiential activities. Exposure therapy. This involves gradually facing a feared situation or object in a safe and controlled environment to disprove inaccurate beliefs. Behavioral activation. Helping that person to increase their engagement in activities that they enjoy and that are important to them. Problem-solving skills. This involves learning how to identify and solve problems in a more effective way. Relaxation training. To learn and practice relaxation techniques like breathing exercises or muscle relaxation techniques to reduce anxiety. The skills learned can benefit you long after treatment has ended. In summary, cognitive behavioral therapy aims to improve mental health by identifying and changing dysfunctional thoughts, emotions, and behavior patterns. It helps us to develop practical tools to challenge harmful thought patterns, manage emotions, and improve coping skills. When applied consistently, CBT can lead to significant and lasting improvement in mental health symptoms and quality of life. Thank you for joining me today. If you like our content, please hit the like and subscribe button. We hope you will join us again on our next videos. For now, do take care of yourself.